Welcome to Ask the Educator, a podcast brought to you by Healthmark Industries. Are you a sterile processing technician or manager? Maybe you work in infection prevention or biomedical engineering. Whether you're a frontline tech, endoscopy tech, OR nurse, or surgical services administrator, you undoubtedly have influence in medical device processing at your facility. In each episode, we speak with experts from the Healthmark Clinical Affairs team, industry leaders, or special guests from the trenches to answer your questions and bring you relevant industry information, equipping you for excellence in medical device processing. My name is Kevin Anderson, and I will be your host. Now let's get started. Hey everyone, Kevin Anderson here, host of the Ask the Educator podcast. Happy to be back. I have Stephen Kovach with me, and we're going to jump into a topic today that I admittedly do not know a ton about, but I'm really excited to get into it. Steve, thanks for coming on as usual. And I think this one's going to be really interesting because I can't help but think that a topic like dental instruments and reprocessing isn't going to strike a nerve with every single listener out there because we all have to go to the dentist at some point. And I can just tell you from my own experience that every time I go now that I know what I do about reprocessing and the fact that not every surgical reprocessing area is an equivalent in terms of quality and being up to standard, I am definitely sufficiently afraid every time I go to the dentist to get work done. So,
well, Kevin, why don't we call this open wide? It's the dental clinic. I mean, because this is going to be a wide subject, and maybe we'll have some other conversations or get some dental professionals on with you later. So I'm going to start off with the dental profession is a little different in this sense. If you go into your dental practice and you ask your dentist what organization they belong to, some might not belong to anything. And some might say, well, we get our education through our sterilizer company or whatever. But there is a really good organization called OSAP. It's OSAP. It's the Organization for Safety, Asepsis, and Prevention for Oral Care Professionals. They sort of team up with the CDC, and you could go online and you can get their standards and guidelines and go from there. And I know people have been going to AAMI a long time. There's somebody from the ADA that sits on SD 79. But the real issue is that AAMI SD 79 is the standard that applies to dental clinics. And if you just ask your dentist about their sterilizer, they'll tell you the majority of them probably use what's called a mailback service. Kevin, have you ever heard of a mailback BI service?
No, I have not heard of a mailback BI
well,
service.
This is how it goes, okay? Once a week, you run your BI, you put it in a little envelope and you mail it to a lab. And let's just say takes 2 days or 1 day, then they do whatever they got to do. And 5 days later, you get it back. And that's what you got to do once a week. And you're meeting the standards. And that just doesn't seem adequate because here's the other debate. Is your mouth a sterile cavity? Is it a clean cavity? What is it? You know, the same thing with their sonics. I want you to think of this next time you go in your dental professional's workplace. At least it's happened where I've been. I want you, as you sit in the chair, if the door's open, really listen to some sounds, not the drilling and but in the back, you might hear the sonic continuously running. And that happens at a dental clinic I had gone to for quite a while. I'd sit there and I'm going, what is that noise? Yeah. So, Curious Steve here, I says, what is it? Well, that's a sonic going. It's going through it's nonstop.
Yeah.
But we know you shouldn't be doing that. And I says, well, what's going on there? Well, we just keep the sonic running. We put the instruments in and out through the day and then change the bath. And okay, well, that's really good, Yeah. Okay. And I cringe, and I've had some talks with my dentist and we've helped change some things, but it's a little different. How do you tell a dental professional, and Where do you get books on other than Amy and a few things? But you think about the dental, cleaning is cleaning, sterilization is sterilization. It's going in your mouth, whether you think if it's clean or dirty. But think about it. They've got two unique sets of instruments, and I'm going to break it down. One is simple in my mind, and the other is complex. The simple are the picks and the probes and all that. And you know what? They're doing the gaps and gum and all those things. And those, are fairly easy. But then when they use the cement, and about bone cement, this cement, they have cement that gets stuck on their spatulas and different things. So how do they clean that? But then they have drills. Drills are an issue. Little different than ours, but they're still drills, and they're getting blood and sputum and, all that stuff in there. So what do you think, Kevin? Next time you walk in, I just threw this out to start the conversation.
No, I know. I think what we need is some sort of standard way of greeting a new dentist office in a way that tells them, hey, I know a lot about sterilization and I need to know what your practice is. So like, how do you broach that subject? How do you start asking them to let you in and audit the place before you submit to their care? I remember talking to Nancy on Nancy Chobin on a side subject, through email about dental. And she said, absolutely. She has had conversations with her dentist about, and she's even left certain dentist practices based on those conversations. And that's that's what we need to equip each other with. How do we go in and have these conversations? Because they're really important. And clearly there is a gap between what's going on in the medical facility and what's going on in the dental facilities. And you brought up a great point. Is it clean? Is it dirty? Or is it, where does it fall on that spectrum when it comes to like a Spalding classification? And in my mind, yes, the mouth is dirty, but like to your point, they're using drills and they're getting into the sterile tissues at some point. My teeth
bleed, so they're going. Kevin, they're in a sterile bit. They're cutting. I'm
exactly.
Sorry.
No, that's my point. That's, it might start off in a dirty area, but it's somewhere along the line, depending on the work that's being done, we're crossing that line. Just like in GI, when you do a biopsy, you're crossing that line. When you're doing some of these procedures, you're crossing that sterile barrier line. So it's a very important subject, and the dental health is very much related to overall physical health. And we know that. And so things sound like to me that they need to change.
So I want to, this is going to be sort of two-phased, and I just want to make sure I'm not making people not have confidence in their dental professional. They have people who go in and audit them. And if their guidelines are saying once a month or once a week, and they're doing that, then they're meeting that standard or guideline. That is, and we know that can happen in a hospital. It says minimum weekly, preferably daily. It does say if they're doing implants, they must run a BI. But if they're doing a mailback service, that's not coming back right away. But that's a whole other issue.
Right.
But how do you get people to go to best practice? And now instead of them, I don't know what a BI is, I'm just going to make it up. It's $10 and they're doing one every day. That adds to the cost of their practice. Or you and I will, and I don't want people to think I'm trying to get people to buy our products, because we believe in quality. But think about it, the sonic that is continuously running, just because it's making a sound, you've seen it, Kevin, doesn't mean it's really cavitating and working. It's a great expensive soaking tank then. So how do we help people go to that next step? And part two of this, and Kevin, I'm showing my age, and I want to give Chuck Hughes in OSAP a big shout out. For those of you who don't know, Chuck Hughes has always been very, he's retired now, but he was always very big in promoting dental quality.
Sure.
And back in the 90s, he did a movie where they actually, this was after the big HIV and everything, where they actually showed the splash that comes out of somebody's mouth.
Oh.
And it is really great. I've been trying to find it. And that's why they started wearing more face shields and gloves and so on. And then what happened now with COVID, but they showed that the splash of just the saliva hitting everybody was phenomenal. And this sort of correlates to something that just came out with Corey Ofsted. She just wrote that article in AJAC about the splash and decontam and all that. So doesn't matter, dental clinic, ASC, we're supposed to focus on dental clinics. It's all important. Yeah, they're sort of meeting the standards, but sometimes which one are you using? How do you, who's that chef? Emerald, bam, you got to kick it up a notch, you know? Right? And
that's a great reference. Yeah.
But you know what I mean?
Yes.
Okay, my spaghetti sauce is good. I made it right, but I can bam it and it can be better. And the better could be doing a biological every day, checking my sonic every day, whatever. And we didn't even get into, I know I'm chatting quick here, but they also have other issues. They have the water lines. Yeah. That's a big issue. That water is stagnant. They have certain things. They have to clean those water lines. Think about it. It's coming out. You're the first person that day? Did they clean out the lines? Was that water stagnant? I mean, dental clinics are very important, and you hit on it. Our dentists, they examine your mouth, and it's for heart disease. You know, it's an important topic. I'm glad we're just talking it to get people thinking out there, Kevin.
Yeah, exactly. And one thing that you bring up a good point, because one of the things that I didn't know is that they had OSAP and they have industry standards, which is great. I have no clue how often they're updated. I have no clue how much education even the dentists have regarding the sterilization. When I think about the amount of education that our surgeons have about sterilization, and if it's anything the same, that's a little bit concerning, because surgeons, as you know, don't get educated on sterilization. And also, I think about other procedural areas, and one of them specific comes to mind, and that's OB. And when OB does their own surgeries, like C-sections and things like that, oftentimes that's in their own OR with their own staff. They don't have OR staff there. And at least at my former facility, those OR techs, those surgical technologists, were not actual surgical technologists. They were trained on the job by whoever came before them. So there was no understanding really of, from a formal education standpoint about sterilization. It was just training, on the job training. And so that's what I'm wondering about dental when it comes to running that tabletop sterilizer, running that ultrasonic. Are they getting any of that in their formal education about how to test the sonic? How does it properly run? How does the sterilizer properly run? How do you know how to test it? And, what are the implications of that if you do have problems? Like, is that part of their education? I would love to know those things, because I'm not real sure, because there was a few times where I did get the gumption to ask some questions of my techs that were helping do the cleaning, and they didn't come off very knowledgeable. Maybe they didn't understand the questions, because patients typically don't ask them questions about their cleaning and sterilization procedures, but I wasn't overwhelmed with confidence after having the conversation.
And that could be you're sharing your experience and now thinking about the dental office. Again, I don't want people to start going out. Some things you can do is, when you walk into the office, what certificates do they have for the staff? I've been in many dental offices. We didn't even get on the washers. And I don't even want to tell you about the washers. We can talk forever. But this one doctor does belong to OSAP, and he goes to the meeting every year, and his staff follows their infection control guidelines. So you can see and ask them certificates what they've gone to. And again, it's how do you approach them? There's a book that I don't think a lot of people know about, Kevin. I think you know about the AKI Institute out of Germany. They put out the Red Book, for instrument reprocessing. You've heard about the Red Book from AKI?
Yes.
Well, guess what? They have the Green Book for dentistry. Now, it was last updated in 2016, but when I get calls from dentistries or from dental professionals, I tell them about this book. It's free. You go search it, AKI Dental Green Book. Again, it's got a little more European flavor to it, but it's a good book to help start what to do, the issues. And a lot of it, they're all the same. We're all reprocessing instruments. We got to clean and brush and do that all the right way. It's how do we help the dental professionals? And again, it gets back to some people I've talked to, well, the mouth isn't sterile, but I know we only try to do this for 10 or 15 minutes. And I just thank you for wanting to open people's eyes to think about their dental professionals. And for us who go in and audit, we have done some dental clinics, and we try to help them and tell them about ANSI AMI ST79, which they should be following. And they have small tabletop sterilizers. I got pictures where they just jam this stuff in there. And it's not everywhere, everybody. Again, I don't want to paint this horrible picture, but it's all about training and education. Like you said, your OB, we're here to help and to raise the level to get that confidence up, Kevin. I hope I didn't make it too, that's scary out there, but
No, I that was probably me doing that. But the reality is that we all have to remember too is, okay, I'm such and such years old. I've gone to the dentist all these years. I've not really had any issues. Yes. So, I mean, like we do have to fall back on our experience a little bit and not overwhelm ourselves with fear. Yes, we do need to raise awareness. We need to, whether it's our own understanding of what's going on in the dental industry and trying to, cross paths in there and help each other out. But, overall, we can't overwhelm ourselves with fear and just not get the important work done that we need to get done.
That's right. With that real quick it's very interesting that, again, as with anything, you try to teach and get people to understand, there could be a better, you could do this or try that. And if they haven't had issues, why? Well, you want to try to always get to best practice. And as people are more educated, we know it's happening with our physicians. Now, not everything is true on Google or where you search, but physicians now are being challenged in a different way. Their customer or their patient is saying, well, I've read this, I've heard about this.
Oh, yeah.
What about, and some
true.
of it is just advertisement from TV. I want to take this drug or whatever. But that too, you have a dental professional, they've gone to dental school, or hopefully your hygienist went to and became a certified hygienist and just wasn't trained or whatever. And they understand the foundations, because we know what happens in our own reprocessing. If people don't understand the foundation, it makes it difficult on what they're doing and understand why they're doing it. And that's what we want to do. Why would you test every day? Or why do you do this? Or why do you brush that way? Or what's the best way to take cement off something? So, Kevin, thanks for just having a pretty frank conversation of dental clinics is another area. We need to help them, kick it up a notch, as I just said today. So hopefully this will be well received by the dental industry. It's not knocking them. Trust me, I get lots of dental work.
Yeah. I've had my share as well. So no, it's been great. I appreciate it, Steve. And I've been learning a little bit as we've had this discussion and had some discussion prior to recording. And it's definitely an area where I need to learn a lot more. But thank you as always. And we'll see you on the next one.
Okay. Take care, Kevin. Thanks again. Bye-bye.
That wraps up this episode with Stephen Kovach. Just as a recap, we were talking in general about the dental industry, Like sterile processing in the hospital or the ASC setting, the dental industry is in need of sterilization education as well. And maybe there are ways that we can help. This is something that we should all be thinking about because we all need routine dental care and procedures. We may not all need surgery one day, but we sure will need dental care, which incidentally is closely tied to our overall health. So what can we do to help the dental industry? This is a question that I would like for people to give some consideration. If you've had experiences with your dentist where you've reviewed their sterilization procedure or just had conversations with them about these critical processes, we'd love to hear about it. You can reach us at asktheeducator@hmark.com. I want to thank you all for listening, and please remember to subscribe to the podcast. All opinions expressed on this show are those of the presenters. Before using any medical device, it is important to review the device manufacturer's instructions for use.